Hello everyone. In today's lecture we shall take up the next practical, that is study of different routes of drugs administration in the mice. Okay, so we are going to study the effect of using different routes of administration over the action of a particular drug. Okay, so we are going to first of all see how the different route of administrations are utilized in the mice. Second aim of the experiment is to study the onset and duration of action of phenobarbital sodium in the mice when this particular drug is given by different routes of administration. Okay, so how does the onset of action and the duration of action varies depending upon the change in the route of administration. So the requirements of this as follows. The animal used is mice weighing in between 20 to 25 grams. Then the solution which is required is, that is the drug which is used to study the effects of the change in the route of administration, is phenobarbital sodium in the dose of 45 milligrams per kg. So preparation of this particular solution, drug solution, is as follows. You need to prepare a stock solution of 4.5 milligrams per ml of the drug and inject 1 ml per 100 grams of weight of that particular animal. So this is how the dosing of this particular drug can be done. Okay, administration of the drug can be done. Coming to the principle of the experiment. Now, as we have already covered under the theory, the pharmacokinetics and the pharmacodynamics of a particular drug. Okay, so we have seen that there are certain parameters which will deal with the movement of the drug in, through and out of the body, that is the pharmacokinetics. And we have also covered the pharmacodynamics, that is how exactly the drug is producing the actions. Okay, so now under these particular aspects we had seen these two concepts, that is onset of action and the duration of action. Okay, onset of action of a particular drug, it is the time at which the drug starts showing its action after the administration of that particular drug. Okay, so supposing if I take a particular tablet or an injection at 9 am, okay, so after how long it will start producing its action. Now supposing if you administer the drug by parenteral route, obviously it will show quick action. We have seen the properties under the routes of administration, right? Okay, so onset will depend upon the route of administration. So also the duration of action, that is the time for which the drug will show its action. Okay, so every drug, one particular dose when you are administering to a particular person, it will start showing its action after a particular time and it will act for a particular duration of time. So that is known as the duration of action, onset of action and the duration of action of that particular drug. Now both these properties of the drug, they will depend upon the route of administration. Okay, for example, under the routes of administration we have seen that any drug which is administered by parenteral route, it is placed either directly into your systemic circulation or it will be placed in the vicinity of the blood vessels, so that it quickly enters your blood circulation and it will show very much quicker action. Okay, in case of intravenous route, IV, that is your drug is directly placed into a vein. Okay, so when a drug is placed in the vein carries that drug along with that blood, it will carry the drug to the heart and heart will pump it throughout the body. Okay, so this particular route, that is intravenous route, it is the fastest route, that is it will show instantaneous action. The drug will start acting instantaneously. Moment you inject, within the few fraction of seconds it will start producing its action, as compared to the oral administration. Okay, now when anything is administered by an oral route, what will happen if you are administering a tablet, say, it has to first disintegrate. Further, those smaller particles, they have to dissolve. So your drug should be soluble in the aqueous medium, then and only then it can enter your systemic circulation. So before it enters into your systemic circulation, anything has to cross a plasma membrane, your enteric barrier, it has to cross, right? So it has to cross a plasma membrane, reach in the interstitial tissues, from there it will enter into your blood. Again from the blood it may go to the liver through the portal vein. That's what we have seen. First fast metabolism takes place. It is significant for certain drugs. So entire amount which you administer in case of oral route, it is not necessary that entire amount will reach your systemic circulation. Okay, certain amount of drug will not get absorbed at all, or if at all the absorption is good, some amount of the drug may get metabolized even before it reaches the systemic circulation. Okay, so obviously there will be a time lag, there will be a delay before your drug will start acting. Unless and until it reaches the systemic circulation, it will not produce its action, right? So there is a delay in the action or the onset of action of your drug, and certainly entire amount is not reaching your systemic circulation, right? So obviously when you compare it with the IV route, wherein entire amount of your drug is in your blood circulation. So you know, if you are administering 100 milligrams of your drug, you know that entire 100 milligrams is in your systemic circulation. That is, the bioavailability is 100%. But that is not the case with the oral administration. Some of the drug or some amount of your drug may not reach the systemic circulation, or it may get metabolized before it reaches the systemic circulation. So obviously it will have a time lag for it to produce its action, plus the duration of action also will not be the same as that of IV route, because some amount has been lost, right? Entire amount has not reached your systemic circulation. So there is less amount of drug. So obviously it will act for a lesser duration of time. Okay. Now, in this particular experiment, we have selected this particular drug, pentobarbital sodium. Okay, it's a barbiturate basically. These were quite popularly used earlier as sedative hypnotic to induce the sleep, to calm down the patient as well as to induce the sleep. It belongs to the barbiturate class. But since benzodiazepines came into picture, phenobarbital or pentobarbital, butobarbital, these type of drugs have almost gone out of use. Okay, so for this experimental purpose, we are going to use this drug pentobarbital sodium. Okay, now why this drug we have chosen is because it shows a clear-cut onset of action. That is, the animal, when it goes to sleep, it loses its writing reflex. Now a writing reflex is the one when you place the animal on its back, that is the mice or a rat. When you place it on its back, what will happen? The animal, when the animal is awake, it will correct its posture. Okay, it will be able to maintain its upright position. Quickly it will change its position. Okay, but as a result of effect of this particular drug, this animal loses its writing reflex. That is, even if you place it on its back, it will not regain its upright posture. Okay, so also it shows a clear cut end point. When the animal recovers from the sleep, it shows that writing reflex. It will quickly correct its position. So it's very easy to identify very clearly the onset of action and the recovery from the sleep, for how long it is sleeping. It's very easy to note down. Okay, so also these particular effect, loss of writing reflex, that is shown when this particular drug is administered by all the routes. Okay, whatever route you choose, these particular writing reflex will be lost. So it's very easy to identify the onset of action and for how long the action is lasting. Okay, now the routes which we have chosen for this particular experiment is intraperitoneal route, intravenous route and the oral route of administration. Now coming to the procedure, first step is to weigh and number the animals. Okay, so we need the mice weighing in between 20 to 25 grams. So you need to confirm the weight, whether it is lying within the appropriate range, number these particular animals and divide them into 3 groups, each consisting of at least 6 mice. Okay, so we need 3 groups, one for intraperitoneal administration, second one for the intravenous administration, and the third one for the oral administration of the same drug. Okay, so same drug is administered by 3 different routes. Now for intraperitoneal injection, it is made in the abdominal region, okay, under the loose skin. Then in case of intravenous administration, the dorsal tail vein is utilized to inject your drug. And for the oral route, obviously the feeding needles are available. So your drug is administered to the animal with the help of these appropriate feeding needle. So your feeding needle is placed just onto the tongue and it is just pushed downwards, okay, gently, and gently the solution is pushed in the mouth. Okay, now while administering the drug by this oral route, you should be very careful in that sometimes the needle may be inappropriately placed. Okay, sometimes the needle may enter into the trachea. So in that case, how you will identify whether your needle is correctly placed? If the solution is coming out from the nose, it indicates that the drug is not entering into the GIT, it is going into the trachea, okay, or the animal will try to resist it. Okay, so wrong placing, it needs to be identified. So it's a very skillful procedure while administering the drug by any of these routes to appropriately place the needles, okay, so that appropriate administration is done, because the entire drug has to be administered to that particular animal. Now once you administer the drugs by these 3 routes, okay, first of all you should note the time of injection or time of the administration of the drug, either injection or administration by the oral route. You should note the time at which you are administering, okay, and the time at which it starts showing the action. That is, as I have told you earlier, pentobarbital sodium, it is a sedative hypnotic, so it can induce sleep. So this is our parameter. You need to check for how long the animal sleep and at what time it begins with that particular sleeping parameter. Okay, so what is the time of onset of sleep? So how you will come to know whether the animal is asleep? It loses its writing reflex. So that point is the onset of action, that is onset of sleep, which is induced by that particular drug. Okay, now how do you identify the duration of action? That end point of the sleep, it is identified when the animal corrects its posture. When it regains the consciousness, the animal will turn over and come back to its normal posture. So this indicates the end point. Okay, so the time at which the animals fall asleep, that is onset of action, till the animal regains its normal position, that's the duration of action. So you need to note down the time of administration of the drug, the time for which it takes to fall asleep, and the time when it regains the consciousness. Okay, now while keeping these animals, once the drug has shown its action, it's very important to place the animals separately. Okay, because every animal will not show same duration of action, right? All the animals will not sleep for exactly the same time, right? So some may recover little bit earlier, some may recover little bit later. So what you need to do is, the animals are supposed to be placed apart, preferably place them in different cages, otherwise one animal may disturb the other one once it recovers. Okay, so it's better to place the animals in the different cages. Okay, now you need to note the time of recovery and calculate the duration of action, and compare the onset of action and duration of sleep due to administration of this pentobarbital sodium when it is given by 3 different routes, that is IP, IV and oral. Okay, now from this we can tabulate the results in following manner. Okay, now this particular table shows the data for the IV route. Okay, when you administer the drug by IV route. So three different groups we have made. Okay, so out of this, the first group, which contains 6 animals, as you can say, the weight is also in the appropriate range. Route which we have used is the IV route. This is the column which is showing the time of injection, that is TI. At what time you have injected the drug, or at what time you have administered the drug to that particular animal. So here in case of first animal, we have administered at 11 am. Second animal was administered at 11 am 2 minutes. Okay, then in case of third one, it is 11.4 minutes. Okay, and so on. Then next you should note down is the time when the animal falls asleep, that is denoted as TS. So in case of this route, as you can see, the time of injection and time where the animal falls asleep, it is the same, right? So this indicates that the animal falls asleep instantaneously. Immediately after the injection is given, the animal falls asleep. Okay, so what will be the onset of action? How you can calculate the onset of action in minutes? It is TS minus TI, that is time when the animals fall asleep minus the time of injection. That will give you the onset of action in the minute. So as you can see over here, it is 0 because the animals fall asleep instantaneously. Then next, what we are supposed to note down, the time when the animals wake up, that is denoted as TW. So here you can see in case of first animal, it went asleep at 11 am and it woke up at 11.30 am. Okay, so this indicates that the duration of action, that is TW minus TS. Okay, when it wakes up minus the time when it falls asleep, that will give you the duration of action. So in this case, it is 30 minutes. In case of second animal, it is 33 minutes. Third, it is 32, 33, 33 and 33. So the average duration of action in minutes is 32.33 and onset of action is 0 minutes. So it acts very quickly. Then next route which we have utilized is the oral route. Okay, so here again we have noted down the time of administration, time when the animals fall asleep and the time when the animals wake up, and we have calculated the onset of action and the duration of action in minutes. Okay, just like in the previous case what we have done. So here, as you can observe, that the onset of action, it is round about 1 hour. So it takes 1 hour for your drug to show its action. So the animal does not fall asleep very quickly over here, but it takes some time for it to show the action. So here we can see that the onset of action is nearly about 1 hour. Okay, so the time of onset of action, as we have calculated, TS minus T1. So in almost all the animals, it is taking round about 1 hour to show its action, and the duration of action, it is reduced, right? It has come down to 20, 23 or 20, 23 and 22 and 21. So average duration of action is 21.5 in this particular case, that is in case of oral route. So we have seen that the onset of action is delayed and the duration of action has been reduced. Okay, and the next route which we have used is the intraperitoneal. So again, in the same way, as we can see the onset of action which we have calculated. Now here the onset of action is less as compared to the oral route. So intraperitoneal injections. So here the drug is placed in the vicinity of the blood vessels. So here it takes a little bit time for it to show its action. Around about 9.5 is the average, and the duration of action, it is obviously more than that of the oral route, but obviously it will be less than the IV route, because here again there is chances of some losses to take place. Some drug may remain bound to the surrounding tissues and all. So entire drug will not reach your systemic circulation. So obviously the duration of action is little bit lesser as compared to the IV route. Here you can see that the duration of action, the average duration of action is 25.33. Okay. So using these observations, we can plot a graph to compare the onset of action as well as the duration of action by these three routes, that is IV, oral and IP routes. So what you can do is plot average onset of action in minutes and average duration of action in minutes on the y-axis for these three different routes. So your graph for average onset of action in minutes will look something like this. In case of IV route, it is 0, right? It shows the action instantaneously. Whereas in case of oral route, it took around 1 hour to produce its action. Whereas in case of IP, intraperitoneal route, it showed round about 9.5 minutes is a mean to produce its action. Then we can also plot a graph of average duration of action in minutes on the y-axis. So as you can see, when we compare these three routes, the longest duration of action is with that of the IV route, because your entire amount is in your systemic circulation. Next is the intraperitoneal, because no doubt you are injecting it by parenteral route, but still entire amount will not reach the systemic circulation. Okay, so it shows a little bit less duration of action, and the lowest duration of action is with that of the oral route. Okay, because here there are lot of losses of the drug. Entire drug may not be first of all absorbed into the systemic circulation. So that is the reason why it is showing the least duration of action. Okay, so what you can infer from this particular experiment, that intravenous route, it produces quick onset of action and long duration of action as compared to the oral route of administration of the drug, that is pentobarbital sodium. This is the reference. Thank you.